Hello, dear colleagues. Hello. My name is Mynzhylky Berdikhojayev. My assistant, Rowan Maratwa. Our operating nurse is AVM. Yes, and it was a question from Rowan about ballast catheter. Ballast catheter is a 6 French introducer sheath, but it's long, it's 90 centimeter. And at the same time, it's a guiding catheter. If it's a guiding catheter, it's a 088, which is 8 French guiding. And we put the 6 French Judkins right for navigation because the tip of the ballast is straight. And he did in a correct way, yes. And also ballast has this small connector, like an introducer. It could be used in that way or in this way. We're usually using like this because 8 French Hyperion, which is coronary guiding, we're using like introducer sheath with 6 French diagnostic catheter. Same idea. Yes, it's correct. And 2 Y connectors through the very short 8 French introducer. And this case is brain AVM case. I will just show you the. This case was the case of Attura, and we embolized this AVM with the approaching from the anterior cerebral artery, ACA, and the part of the Attura is disappeared. I think the medial part, and you can see this video from 19 or 18 of, not 19, yes, on 20 September it was Friday, 19 September, it was on Thursday. 19 September, you can see the YouTube, and it was a Obtura liquid embolic injection from Spain, and you can see the cast, and now the part of the cast is disappeared, and the posterior part of the cast is still there, but it's not so dense, and if we will inject squid 12, it will be visible. And I will take a couple of few minutes, just a second. Just for explanation about 8 French. Just a second. 1 minute wachten, давай. Yes. Жень, меня видно же, да? Okay. This is a Teruma destination. It's a 6 French. And if you see the box, it's a 90 centimeter, and the inner diameter, it's a maximum guide wire, it's about nothing. 6 French, 2.2 millimeter inner diameter. No, it's, I think yes, inner diameter. And this is a ballast. It's also long sheath, like a Teruma destination, but destination is very stiff. It's like a stick, and the ballast is soft, and this is 90 centimeter, this is 90 centimeter. And also we have a Neuromax, it's long sheath, 088, the same inner diameter, but it's a little bit more, 224. It's the inner diameter. Inner diameter of destination, 2.2. This is a little bit wider, and the ballast inner diameter is just a second, just 0.88, like in Neuromax. Okay, and also we have a Hyperion. Hyperion is a classical coronary guiding catheter. Outer diameter 2.7, and inner diameter is 228 millimeter. 0.90 inch. which is a little bit larger than 6 French ballast and 6 French Neuromax. All this is 8 French guiding catheters. 6 French, 6 French, 6 French, but it's 8 French guiding. To understand the difference between guiding catheters and to do correct procedure, I decided to explain because Rowan, our young neurosurgeon, just graduated residency in neurosurgery, and he's used to do endovascular, but still questions, I think, in experienced colleagues, and that's why you need to see the box and you can read which diameter. Okay, let's start. I need to go out because it's a radiation, and I will use my zero gravity protection. Okay, and Ravan, now start the diagnostic. Бүкіл тамырларына кіріп шығасың ғой, Рауан? Наружкасына сол жағынан кіресің. Okay, now Ravan will start, and I will switch off my audio till the start of the procedure. Ravan, 1 second. I need to put liquid embolics. We will take squid 12, squid 18, one box, and maybe one Minox. Осылай қоясыңыз, но между тұрыңыз. Сосын босап жатса, орнына қойыңыз. Okay, let's start. Все, можно. Dear colleagues, diagnostic angiography ready, and let's see the vertebral artery territory, no AVM, and might be something from the ACA territory, let's see. Yes, there is a small feeder coming from the ACA, and it's paracentral near the central sulcus. So it's mostly from the ACA on the left side. Okay, from the right side, nothing. Nothing is coming from. It might be something from dural. Okay, let's see. We need to check left side meningeal branches also. It might be some connection from the meningeal. Okay. Сейчас вот это, да? And the left side, yes, remaining part mostly from the MCA and remaining part mostly from the MCA. Okay. That's a draining vein with ectasia, and it's going to the sagittal sinus. And there is stenosis. There is stenosis. Okay. Minimum 1 to 3 branches coming from the MCA, and the draining vein is stenotic. Draining vein is stenotic. It might cause some edema, and let's see where it is. Okay, it's a little bit lateral to the previous cast, and it's a bit anterior to the previous cast. And okay, let's see right side. It's AVM. AVM is here. Let's see. Yes, it's the position of previous cast. We need to go to the ACA to control, and MCA will be the main approach. Okay, left vertebral artery territory is normal. It's not supplying the AVM. Yes, now it's nicely illustrative. Роман, наружен сон на кърп ангиожа седиш? Ау? Слева, слева. I'm asking Rowan to do angiography from left carotid, and if you see, there is a nidal aneurysm at this point. Yes, this AVM is quite risky. There is a venous stenosis, there is a aneurysm, but this AVM was unruptured, and not all unruptured AVMs are safe. Yeah. Okay. The main drainage is exclusively one, and maybe two on lateral. You can see the primary vein. Maybe two. Okay. Yes, there is a quite risk of right hand paresis, and we will do it more. We'll try to do it in a most safe way. Okay. Yes, venous approach is discussable, but with this venous pouch and venous stenosis, I think it's not the best candidate. The open surgery also discussable. And okay, let's see. Наружно е каз кресал. Наружка, каз 1 секунд. 1 секунд. Жаңағыдан смарт маска жасап кіре бересің. Okay, I will take. Unfortunately, we have only 1.5 sonic. 1.5 35. Осы екеуін ашарыз. Ашпаса бересің. Take magic. Okay. Yes, it's quite distal, and I think it will be not possible to go with the echelon. It will be just push and plug technique. It will be just push and plug technique. And all patients from yesterday are okay. And they're in department without any additional deficit. Aşağı verin bari. Tamam. Ne покатраешься? Керек болса ашамыз. Так, хедвей жоқ, поэтому. Так, и екі набор шприц ашасың ба, Айыл? And Nike Shailendra Singh, yes, Shailendra Singh Nike from Hyderabad joined our team. He came yesterday and stayed all day, and I think you really enjoyed, yes, yesterday. Did you enjoy it yesterday? Okay. And today only one case, and we have time. We can do it as much as it needed. There is no hurry. But only problem, headway duo is finished. Yes, because of the budget of joint stock company, Central Clinical Hospital is limited, and there is a reorganization of this hospital. At the end of this year, the hospital will stop existing, and it will be transformed to the governmental hospital. The name will be changed. Till now, the name is Central Clinical Hospital, and in parallel, there is a national hospital of the Presidential Affairs Medical Center. And и тағы бір бесхостиковый коннектор бересің. And Medical Centers National Hospital. It will be new. It's a new name of this hospital, and the old one will be closed. Will be closed. Okay. Okay. I will take this one, and I don't need any flushing. I will put 3. Okay. And about Y connectors, huh? There is a big difference between Y connectors. This is a Merit Medical Y connector. This is Balt Y connector. You can see the difference between angulation. This is nearly 30 degree. This is 45 degree. Yes, maybe 60 degree. This is 45. This is 60. And you can see this is Y connector coming from the. It's coming with the ballast. It's a Merit, and the angulation is similar. And let's see. Yes, it's a 45 degree. Yes, 245 will be 90, and this is more than 45. It's a 60 degree. And when you put in parallel several, with 45 degree, less friction. If you put like this with 60 degree, there is a lot of friction with 60 degree. That's why we're using Balt Y connectors in this way. 3 Y connectors with the 7 French Fubuki, 7 French coronary guiding, and the 8 French guiding catheters. Okay, I asked IOLM to open 2 sonics. One is 1.525 and the second one is 1.535. 35 is like Apollo 3 centimeter and 25 like Sonic 25. Okay. We need to flush, and this one is 25. I put white syringe. 25. Okay. Системасını kazmen australian. Just a second. This is. Okay. Like this to flush. Okay, it could be some thrombus. That's why I will go to the external carotid. We'll do angio, and then we can switch for the internal carotid. For the future, it's to Rowan. There is a connector like this, and then it's working like an introducer sheath. Okay. Okay. Bahara сүресін қосып қоясыншы, Айыл. Okay. Excuse me. Yes, the zero gravity is very, very comfortable. No swearing, no pain in your knees, no pain in your legs, no pain in your back. Yes, I just moved the tube, and then it will be not accurate. Okay. The external carotid territory is very helpful. If you have any problem with the material, with the liquid embolics, and then you can go to the external carotid territory and leave your rubbish there. It's like an ashtray. Yes, it's a good territory, but when you have some doubt about the clear things, and then you can take the territory of external carotid, and it's very safe to take it out. Just a second. Now I will take it out. And we can take some blood. 20 шприц бересің шо? И мынаны жалғай сал, үшінші ой коннекторы. Ой коннекторларын шешіп сал. Ана үшеу қылып жалғай салдым, мынаны алып тастай сал. You can take it to the table. Okay. Now I will take 20 cc syringe and we'll do the aspiration. It is quite safe if you will do it external carotid territory. I will take it back. Now it's safe. Okay. Все, дай ему. Пересол. Все, пересол. Все, берет. Так, ну ладно. Пересол. Okay. Now it's clear. If you need to do cleaning of your guiding, then it's better to go to external carotid territory. Yes. Okay, I will take it out. Just a second. Oh, give me. Okay. It's clear. There's three Y connectors, and this for the flashing of the microcatheters, and I will put it a little bit proximal. Ана үшінші системаны жалғап бере салшы, Айыл. Okay, now we will take the micros. This is 35. And okay, the MCA territory looks bigger, and then okay, and the ACA territory. Just a second. Okay, I will put 35 in ACA, and we'll take 25. No, 25 I will put in ACA, and this is 25. 25 will be in ACA territory. Yes, thank you. And the 35 I will put in MCA. Okay. Yes, this AVM is quite risky with a natural history. There is an intranidal aneurysm, and the draining vein is stenotic. And it's very high chance of bleeding with the natural history. That's why it's an indication for the treatment of this unruptured AVM, yeah? Yes. Because it will rupture. It's just a question of time. Okay, which is navigation is tough, ACA or MCA? Okay, I will put it from the middle. There are two angulation, and the navigation could be a little bit problematic at the end. Okay. Now we are in extracranial circulation, maybe. Okay, there is a little bit friction because of two angulations. Huh? Okay. Okay, this is first. This is in ACA, the middle, and this one will be in MC. Кирилл, пока тура. Yes, it's also possible to use Apollo, but the detachment of Apollo is a little bit. It's need force, and it's detaching by force, Apollo. And Sonic is detaching chemically. Chemical detachment. After contact with the meso, the connected part is start dissolving. And after 20-25 minutes, it's detaching easily. At some point, it's very good, but in some point, it could be very bad because in very important moment, it could detach, which is not possible with. It's possible with Apollo, but it usually takes some force. Also possible to use Scepter Mini. We have one, but I'm not sure if it would be so comfortable to use Scepter Mini here. Okay. The beauty of ballast and any other 6 French sheaths and the 8 French guiding catheter, it's possible to use 3 big devices like a Sonic, Apollo, a balloon, or 21, 27 microcatheter. Okay. Now we are in internal carotid artery territory. Okay. Okay, no problem. Okay, I will stay here. Maybe we need to check extracranial, huh? Let's see. Okay, let's go to the meningeal. We need to check everything before. Okay. Okay, let's go with. Sonic and internal carotid. Okay, I will increase a little bit the radiation. Okay, it's going all the time to the IC territory. Okay, let's take the diagnostic wire. It's went without any problem. Okay, this is extracranial, external carotid. Okay. all small branches, which is not reachable in any other time. Now we're inside, yeah? Okay, no problem. Okay, now we're in extra kernel. Okay, so we can zoom. It's not like we caused a little bit spasm. Okay, not clear connection, but it could be. Okay. Okay, it's MCA and this one is ACA. Гайдқа немотоп қосып қоясыз? Немотоп. I'm asking for Naimodipin in flashing system. Stop. После. Смерть маска бересің. Немотоп 8. Промывка қосасың. Окей. Last time we had been to callus marginal. I think it's not the callus marginal, it's a frontal, posterior frontal. And now we will go to the callus marginal. But in AVM cases, sometimes the branch is coming bigger and it's coming like a branch of the main ACA. Yeah? Okay. Let's send the sync. Koyasın. Smart mask. Bir sekund. I increased a little bit the radiation to see clearly the territory. Okay, I'm just keeping the wire and pushing the micro. Just pushing the micro. And it's stuck in some way. This looks like some branch maybe. Okay, let's do undo from this point and we can modify the micro wire. Innocent cases. It's not the main feeder, it's like a collateral flow. We can put it like just for the control. Period. Stop. Назад. Okay. It's quite distal, eh? Okay. Назад. Чуть-чуть. Okay. Вперед. Stop. Yeah. Smart mask. Okay, we will use it for the control. On the main territory is the MCA territory. René and Alberto prefer to do without needle, with that plastic wires. And if you use plastic wire, then your hybrid is living longer. It's like coil pushing. If you learned to do it with needle, you will continue with needle. If you learned with the plastic from the beginning, and then you will do it all the time with plastic. Okay. Okay, now my hybrid is coming, but it's quite friction because of this a lot of angulation. There is a branch. There is branches, million branches. Okay, now it's going distal. I'm just keeping the wire inside. It's very important to keep the wire inside, because if you come with wire more proximal to the second marker, then the tip could detach.
Okay.
That's why it's very important to have the wire inside the micro. Okay. I think it's stuck somewhere. It's not moving. Okay. I think it's enough. Then it became a little bit dangerous. Okay. Кондиционер другой, да? Okay. All of this is collateral flow. It's a brain and it's a collateral flow. It's going to the MCA territory and then going to the AVM. You see?
Here you don't want to embolize.
Yes, I think we don't need to go there. I will a little bit bring the microcatheter. Maybe till this point. Okay. Yes, it's nicely seen. Yes, it's a collateral. Just collateral. Okay, we will leave it here. I will put the flashing. We don't need this microcatheter for the injection, but we will need it for control. Okay, we will leave it here. I will put like this. Okay. Now we'll use the same angiography. There are 3 branches. 1, 2, 3. Okay, 1, 2, 3. 2, 3. Okay. Let's go. I think we need to do first angiography from here. Start. Сейчас отпусти. Okay. Let's see. Stop. Вперед. Yes, these 2 branches. Just a second. I will take out the roadmap. And we need this image. In the middle it's ACA, and there are 2 branches. It's MCA, yes? That one is a branch where we are coming from top and from backside. Yes, that one. Yes, it's where we are. And but from the MCA there are 1, 2, 3 branches coming. Okay, let's put it here. Okay, these two, and this look like one is coming from front and one is coming, but the bigger one, the back one from MCA, it's giving the bifurcation just at this level. You see, there is a bifurcation. There are 2 branches going inside, and this one, this looks like only one branch. And the bifurcation is here, yeah? Okay. Okay. Smart mask. Проводник пересыл. Проводник пересыл. Проводник. Перейдешь. Okay. Okay, I will do more J because we just need to go forward. For safe navigation, I just gave the J. Ayolum, ta 1D535 Sonic taşıp beresen, şimdi gibridini kaldırdı, Sonic taşıp beresen. Хорошо? Sonic. I'm asking for one more Sonic. Yes. Okay, now it's safe. It's quite distal, huh? Very distal. Okay. Yes. So many angulation. When we push the MCA, our catheter from ACA is going back. Okay. And there is also the bifurcation distal, yeah?
That is going back because we are injecting from this side? The ACA one is going back because we are injecting from this side?
We are, because we are pushing, it's inside the one guiding catheter.
Okay.
That's why it's looked like this. Okay. I'm still pushing, and the micro catheter is going forward. Eh? Okay. Now I'm releasing the micro catheter. And when I release the micro catheter, then it's possible to take out the wire. It's very important when you're pushing the micro catheter, the wire should be between the first and second marker. If it's before the second marker or third marker, then the tip could detach. Yes.
And all hybrid or 0.8?
No. With 1.5, it's coming 8. Yes.
Right.
With 1.2, it's coming 7. It's a James Bond. 007. Okay. Now it's look like we can go a little bit distally. Huh? And it's only one vein, and we can do venous occlusion from the arterial side, and it's possible to finish this case. Huh? Okay, maybe possible, maybe not. Okay, let's see. We have one more sonic, which is 1.535. First of all, we will go with this one, and then maybe we will push the previous one a little bit distally. But it's all the time risky when you try to go distally. Yes. It's all the time a little bit part of risk. Huh? You try to save the brain, but finally you can damage the brain. There is all the time balance. Huh?
Yeah.
Yes, transvenously maybe it's more elegant to not to touch the brain tissue and just occlude the AVM, but till now I have no clear answer when to stop. At which part of the arterial site we need to stop.
Okay.
Sometimes we can leave the feeder and it might bleed. Eh?
Yeah.
If René and Alberto Charbel will write article about when to stop with arterial branches, maybe it will be very helpful. Because for me, I have experience since 2009. I started embolization of brain AVMs, and till now, after 15 years, I have no clear answer when to stop. Sometimes there's tiny arteries, and is it AVM or just a branch? Huh? No answer. Okay. It's a really J shape, and it might be a little bit complex to push. Huh? Okay. It's shipping. It's shipping. Okay. I will do angio from this to see where we are. To check. Okay, it's still in ACA. What I learned from my friends and colleagues, and mostly from Charbel, you need to be ready to occlude artery if you deal with AVM, because it might be big bleeding, and then you should be ready. Eh? Okay. Темса, по-моему, малко не. Пока сквичи на метротрона, contrast cormigot. Okay. Now we need to go to this branch. Okay. The angulation of this branch is a little bit might be complex. Huh? Okay. Okay, it's a little bit quite a big tail of the hybrid. Okay, let's push only the microcatheter, and here could be the branches and the angulation. Yeah? Yes, all of this angulation is quite risky, because there is all the time small branches. Yes, with this sonic, now it's nearly the limit of pushability because of this marker. At this marker starts the stiff part of the microcatheter.
Okay.
That's why there is a sonic 190 centimeter, and this point is more proximal. Okay. Yes, and it's might be limit of pushing. It could be pushed till the cavernous site, and then It's very stiff.
This is 167 strength.
It's regular. Once we need to see the box. Just a second. It's 67, yes.
Yes, 167.
But it's 67 with hub.
Oh,
Yeah. There is a nearly 5 centimeter. Okay. Okay, I'm keeping the wire inside. Yes. Now it's very hard to push the wire. Okay. Okay. Okay, let's see the angiography. Okay, let's do the more. I just released. Push it and then little bit release the microcatheter. Okay. It's quite distal. That's why so many friction. No? Friction. Okay, that's a brain. It's near the brain.
one outflow vein, then 3 arteries.
At least 3 arteries. At
Three
least
or
3.
more. But the
Maybe
vein
more.
is only one, right?
Vein is only one, yes. That's why maybe we are lucky, maybe we are unlucky. Yeah?
Yeah.
Okay. Let's see. There is a branch. Branch to the AVM. And then it go to the brain. Okay. Гибрид семерка ашпыш, айыл. Гибрид семерка ашпыш. Гибрид 7. Yeah, гибрид номер 7. Жоқ. Один. Өйткені өзінікі 8 ғой. Yes, I asked for the hybrid 7. It's a little bit thinner and the navigation is a little bit better. And I tried to use a Traxxas 7 and Traxxas 1214. It's nice guide wire, yes. You can rotate in tortuous anatomy and in distal it will rotate.
Okay.
With many guide wires it will stuck and there is no rotation. The same with the Traxxas 7, yes. If you go distally, so many tortuosity and it's still working. Yeah?
Okay.
It's like guys from Chimkent. In Kazakhstan there is a city Chimkent and they're working in tortuous anatomy. It's just a Kazakh joke. Yes. They can work in tortuous anatomy. Okay. Okay, it's a J to go to that branch. Okay, we'll do smart mask. And René and Alberto working like this.
Yeah.
Yes, and then the wire will survive longer. I started at the time of marathon microcatheter. That's why I learned to use a metal needle, and it's just a habit. Yes, it's just a habit. Okay, we will go to this branch. It will be very quick injection, and we will take out the microcatheter. It's just a preparation. Eh? Okay. But there is a small perforating branch. If you see this, you see proximally there is a perforating branch, and it's also going to the to the AVM. It's very hard to balance. If we will leave it, it might bleed. If we will occlude it, there is a brain. It's in passage branch, more proximal. You see it? That's why it's very hard to deal with this motor cortex allocatory AVMs, and it's all the time risk of occluding something. And we are working at limit. It's a limit of the device. Okay, I put it in the branch. We just need to put the tip of the microcatheter inside the branch. O sugar oldu. Yaramam orası. Okay. Now we are inside the AVM branch. Non-kids closer. Okay. Now we will go to the previous feeder. Okay, let's do angio. And it's touching the wall of the artery, yes. It's very important to push the contrast very gently. And there is a branches going to the brain. That part is not AVM. Coming from the deep side.
That part will get corrected.
Yes, it's a brain. It's going to the deep venous system. Okay. Okay, I will pull my microcatheter a little bit till this point. Okay. Please stop. You see, there is also the perforating branch, but it's going to the AVM. You see? Was it? This branch? It's also the perforator, but it looks like normal. It's not dural, it's parenchymal, but it's going through the brain, and that's why we need this article from René and Alberto and Charbel, from Professor Moret and other colleagues dealing with this kind of crazy stuff. It's very hard to identify which is perforator, and when you're doing transvenous, you all the time need to occlude, but till which point is safe to occlude? Okay, I will take this. It's James Bond hybrid. Okay, James Bond. It's a long procedure, and it's very important to control the flushing system, because it might be risky. Okay. We are not using heparin because we are using the flushing system. When you use the flushing system, okay, let's went to the small feeder. Okay. Okay, there is also should be the branch. The previous position was quite better, huh? Okay. 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 Let's take something bigger. Observe. Oh, it's a big branch, huh? Гибрид восьмерку не косячишь? Гибрид восьмерка.
На унадмаска с восьмерку, да.
Let's take this one. The microsurgeon is looking for this case and saying, okay, it's very easy to reject this AVM. No? But in real life, nothing is easy. I had many patients during the resection of parasagittal AVM. It was disaster. Huh? That's why I tried to improve my endovascular skills because of the risk of the microsurgery. It's not all the time safe. It's not all the time 100% effective. Oh, it's better. Oh, it should go, huh? It's a 8 wire. It's 8 wire. I think there's some small branch and it's sticking at the orifice of this branch. Okay. We just need to reach the same point, which was before. Nothing extra. I couldn't push my micro. Maybe because of the 2 microcatheters and small artery. 3 microcatheters. Huh? Okay. Okay, let's take out the ACA territory. We know the anatomy and we don't need microgrid. Let's put it in the water. Основной mu? Şaus traslanır. Hemen birisi. Yes, it's better to change the flushing system before it will be empty. Ана системаны ауыстыра саласың ішіндегі физраствор. Мынаны ауыстырасың. Ауыстырып қоясың ішіндегісін. Ұста. Okay, let's go again. Maybe now it will go, because of less device in the system. It's not going, It's not going. It's very hard to push. Why it's not going, Maybe we need to change the sonic. Maybe. Okay. Just a second. No spasm, No spasm. Желательно. Okay, let's change this sonic. I don't know why, but it's not even pushable. Тағы бір соник 1.535H бересеш, гибридімен бірге. Свежий гибрид керек. Так, мына жерде восьмеркалардың бәрін алып тастайсаш. Okay. I don't know why, but I couldn't push it. Maybe. Okay. It's lost the pushability. Okay. This 25 will be quite short. Okay. What's this? Хорошо. Okay. It's okay, but I'm not so happy with this sonic. Наш пересаж. Держи, трэш. Держи. Пожалуйста. It's directly going to that branch. That's why it could be better to do J shape from the beginning. Yeah? Sanırım. Okay. Yes, we need to order more 190 centimeter sonics. Then its pushability is better. Is it the same branch? The previous sonic? Yes, it's the same branch. Oh, it's the same branch. Same, yeah?
Same branch.
Okay. Now you can understand the shipping, yeah? It was a little bit hard to go to that branch, and now the device is all the time going the same branch. Now it's different. Yeah? Yes, now it's different. Let's see the previous super selective. Ahmed, Ajok, Ayol. Ahmed çıkardık. Okay. Smart mask. Okay. Pushed in one of the branches. Okay. Okay, now I just little bit released the micro catheter. Okay. It's close to the draining vein. Okay. 1, 2, 3, 1, 2, 3. Okay, let's see the territory of ACA and compare it. This is ACA territory. Okay. It looks like fistula, yeah? Fistula. Second. Take out my roadmap. And now... Koyasın. Oran koyasın. Su atasın. Okay. Let's see the last one. This one, this one, this one, this one. Okay. Let's compare. This is more front. And there is a feeder going to the white matter. It's a vein. It's a vein. Mostly it's a vein. Okay. And then it's more close to the draining vein. Okay. Okay. Now we are controlling nearly most of the part of the AVM. Which squid will be better? Squid 12 or squid 18? What is your opinion?
Squid 18 versus
12. 18 or 12? Okay. Maybe we need to start inject from this branch. Or we can inject from here, very quick and very short, and then we can take it out because there is a branch going to the brain. We just need to occlude the feeder. And now I need to do angiography. Global view. Global view. Okay, there is a spasm downstairs. It's not so good. Okay. Okay, and now I need to increase flushing. Okay, let's check again because it was spasm. Okay. The brain still there, yeah? Okay. Нематоплас koyasır. Bizge нематоплаш. Dexamethasone 12 mg. Kubik alsın. Veriyorum ben bak. Астерильно. Хорошо? Адрес. 2 cc. This is Nimodipine. Yes, it's Nimodipine. Так, squid. Squid 12 jinesir. Okay. This is Nimodipine. And I will mix it with this saline. Just a second. This. Okay. I will put syringes here with dimethyl sulfoxide. Yes, now it's in Nimodipine. We'll mix till 20 and inject 5 cc. Okay. Так, наркоз тереңірек бере саластыр ғой, оянып кетпесін. Okay. Let's compare. Huh? Okay. Okay. Bismillahirrahmanirrahim. Так, униковый, да? Okay, first of all I will inject from this and we'll take it out just for control the proximal part. Okay. That's a half syringe and then flushing. Now I connected the glue. Okay, I asked to put the glue. It was navigate in the roadmap and now it's glue. Now I increase the radiation to see clearly. Koyduk öyle. Increase the zoom. Okay, it should be very short injection without any reflux. I will try to occlude just this branch. Okay, it's refluxing. Okay. There's a small branch coming and now we can take it out. Okay. It's just preparation, no? Okay. Now otur. Kolda böyle. Saf ettim olsun. Так. Тағы да емсон бере сал. It's like a glue injection, no? It's like a glue injection. Yes. This part is occluded. Тағы бір демсу жинап қоя сал, Рауан. Мына жерде шприц бар. Так, сквит 12-ні набирать етсеш, тағы да полный шприц. Okay. I think it's better to go with the squid 12. И squid 12-ні 2 шприцқа жинайсың ғой? Иә, екеуін толтырасың сразу. Так, мынаны қайтадан құямыз да, бұл жинап аламыз. Так, екіншісін бере бер. Ананың қалдығы керек жоқ, новыйын бере сал. И Рауан, в принципе, болады. Орнына бір новый қоясың. Стоп. Все. Okay, now the hub and then first. Okay. It's inside. It's a reflux, huh? It's a reflux. And this is the vein. This is draining vein. Yes, we need to occlude the beginning of the draining vein without penetration, and I think it's a branch coming from the anterior cerebellar.
Yeah, ACL.
Okay, let's see. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13. Okay, these branches. 1, 2. Yes, these branches. It's look like these branches. Eh? Okay, now it's refluxing, but it's okay. Till this point, it's okay. It's a territory of ACA. Yeah? It's a draining vein. It's a cortical part and it's hardly visible. Huh? Okay, let's see. I think the same, huh? Let's look like this. Let's look like this one maybe, yeah? This one maybe. Okay. Let's look like the AC territory is stopped. Huh? Бертни. Медленно. Вперед. Yes, the AC is stopped. Вперед. Okay. But there's still AVM. The part coming from the second branch we occluded just partly. And, it's a draining vein. Ана жерге қойып қоясыңшы AVM суретін. Yeah. Okay. It's connected through the AVM to the feeder, yeah? You see? This is artery. It's connected and now it's a detachable point, but in between, or it's a reflux. It might be reflux, huh? Okay. We couldn't do from there, yeah? We are very poor guys, huh? We have now the review and we couldn't work with the mouse. And if somebody looking from Philips, please help. Okay. Let's pay attention for the AP. Okay? Mike? Okay. You need to keep watching the reflux. And it's very important to... The AVM treatment is a team job. Yeah. It's all the time, it's a team job. Okay, I think it's arterial reflux, but till now it's okay. It was no brain, it was mostly the AVM part. And now we can wait. Yes, it might be small remaining. Might be. It's okay. The venous dilatation is started stagnating, and it may cause some problem, yes, because it will start thrombose because no flow, and it might be venous ischemia. But now we don't see the AVM anymore. But there is AVM. It should be AVM. But it's not visible. There is invisible AVM. Okay. Now it's going to the territory of ACA. And I'm not sure how distal we should go. Or it's better to stop here. Okay. 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 Let's compare. Okay, this part.
Yeah.
It's look like this part. Yes?
Yes.
It's nearly the same. Okay.
Yeah.
Then we don't need to go.
Yeah. This is perfect.
Okay.
From that side also it is covered now.
Yes. And this part is look this part.
Yeah.
Okay. I'm not sure we need to go more distal. Okay, let's wait. And it was some branches coming from above, huh? It's all the time hard to recognize which part is still risky, which part is not. From this point, yes?
Yes.
There is some branch coming from above and
That is current lemon or direct crystal?
Not
Direct
sure.
crystal.
but where is the part going to the vein? Eh? Okay, now I think we need to put a second microcatheter at the same branch. We have time. And also it will be helpful to retrieve the first microcatheter. Yes. Okay, we have time. It's a squid 12. I hope we have time. I'm not sure. But usually it's not so problematic to go with squid 12. Huh? Okay. And there is no possibility to push the timer from this point, from the operating room. Okay. I will put the microcatheter and then we will push the squid to prevent the stacking inside the microcatheter. Okay. Till this point, it's okay. 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 Yeah, that's okay. It's a reflux. Okay, it's still okay. Okay, now we will do shipping. Yes. It's a shipping. There is a plastic inside, and the second plastic will just follow the first one. I hope it will follow. Yes, it followed. Then we can check the proximal branch. Yeah? Something from here. I think it's a brain, yeah? It's look like brain.
Now it's looking.
It's look like brain. Stop. Yes, it's look like brain. I'm not sure this is a AVM. There is a brain and then brain. Yes. Okay.
Now AVM is uploaded full.
It's look like. It's look like. But till the vein is not occluded, you couldn't sleep well, yeah? You need to see the vein occluded. If not, it's refluxing. Okay. Yeah, let's wait. We have time. There is no cases for today, and after this case, we will clean the room, and then we will do one more live stream. I will show the difference between guiding, between microwires, between microcatheters, and the camera is really strong, and we can show. Okay. Okay, let's do. Okay. Let's look like okay. Okay. And vein is stagnating, yeah? Вперед. You see? There is a stagnation in the venous aneurysm. It's good and it's bad. It's good. The vein is not existing. It's bad. It starts thrombosing and it may cause the.
Should we? Can we remove this from venous side?
No, it's not necessary. Just we will do expert CT. If everything is clear, then we will give heparin. Yes.
So in this system, there is no heparin?
No. We are not using heparin. And
So only nimodipine?
only nimodipine, yes. It's to prevent any hemorrhagic complication. Yeah? Because the risk of hemorrhagic complication is higher than ischemic.
Oh, okay, got it.
Yes. This brain is used to be in a ischemic condition. It's all the time sucked to the AVM, and in most of the time. And it's look like a bit spasm proximal. Release my guiding. Okay. Let's see. It's spasm. I especially leave this microcatheter because it's too much tortuosity, and when we will start to retrieve the first microcatheter, it could be some problem with the short perforators on M2, M3. That's why better to have a microcatheter near, and we will put the wire also. Okay. It's very helpful. But we're working more than 15 to 20 minutes, no? It's still refluxing, no? Still refluxing. Okay, let's wait. It will go. Just need to wait. We have small part of the AVM. This is first microcatheter injection,
Yeah.
and this second. And in between there is AVM.
Okay.
It might thrombose, then it's okay, but it might survive. Then it's a problem. Okay. We had 1 liter salines, and then it's a problem of healthcare system. The price of the 1 liter and the half liter, there's not so much difference. But the most used volume is 200 milliliter.
Yeah.
It's a lot, and 400 it's medium, and the 500 it's okay. But 1 liter only for such kind of procedures. And 2 liter saline is mostly for the hemodialysis.
Okay.
Yes, and they're taking saline from B Brown, and it's a little bit expensive, huh? Okay. But for the safety of endovascular procedures, we need a 1 liter. It's better to have 1 liter than 2 salines with half liter. Okay,
Now,
let's start filling.
yeah.
I think it's a draining vein. It looks like draining vein, yeah? Okay. No need to rush. It's a vein going in parallel. There are 2 veins. The bigger one and the in parallel smaller one. And people are scared to use squid 12. They think squid 12 is not producing strong reflux plaque, and then it's not possible to push the squid. But the artery is quite big, and we didn't reach the second marker, which is 3.5 centimeter, and it's quite a safe distance. And we are using squid 12. It's not 18. And also the venous side, it's also possible to control. Yes, how many physicians, so many opinions, yeah? Okay. Yes, now it should connect with the first branch. When you reach the vein and start to occlude the beginning, then you may connect with the other arterial feeders. It's very important. Huh? Так, она бери салсма? Свежего, да? Как норма крёса. Okay, I took a fresh one. It's more black and visible than previous one. It's this part. This part start occluding. We need to do sculpture of this. And till this point, occlusion of the vein is safe. And then there is a something coming. It's a vein from the brain. Yeah? It's a brain veins territory. Okay. 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 I think it's a connection between the previous branch, the first branch. Huh? Okay, let's start filling the remaining part, and also it's a little bit went to the vein, and now microcatheter is more dark, huh? Because all liquid embolic inside the microcatheter start moving.
Stop moving.
Started moving inside the microcatheter. Yes, it's moving inside. Huh? You can see the drops of squid. Yes. Yes, because of all first liquid embolic was onyx. We are all saying it's onyx.
Yeah.
But it's EVO, ethinyl vinyl alcohol copolymer. Yeah? But yes, it's like all FD is pipeline.
Yeah.
Okay, let's wait. You see the difference between Aptura and there is still stagnation in second. Now it's better, huh? Now it's better. Microcatheter. This is the first branch. Yes, it's still there. You see the difference between Aptura and squid?
Yeah.
Yes. Maybe it's time to stop, yeah? Yeah, because all liquid embolic is trying to go to the venous part. And I think it's quite enough, huh?
Yeah.
Okay, let's take this. Okay, I will do the J. It will help to prevent any complication. Yes, the venous outflow is now stagnating. It's good and it's bad. As I said before, it's good and it's bad. Okay, let's leave it here. I will do one more push and then we can take it out. Yes, it's inside the vein. Чекай. Пустой шприц перед собой. На нос. И Ром. Пустой шприц. Пустой шприц перед собой. Yes, till this point it's safe. Okay. Okay, let's do less zoom. Like this. Yes, there is no AVM. Okay, and venous stagnation. Okay, now you need to take it out because the table is moving and the image may move. Okay, now I will straighten my. Okay, I will a little bit pull the second sonic. It's enough. And now I will start to retrieve the first one. I will take a little bit back. There is no high tension, it's regular. Okay. It's a beauty of sonic. With Apollo it's not possible.
Now it's not broken, right?
No, it's detached. Yes. At the level of second marker, it's detached. Sometimes it's detaching at the level of third marker, but mostly at the level of second marker. Okay, I will take the wire. This was super selective angio. Okay, let's check if everything is okay. Okay, the brain is okay.
The parenchyma is also remaining now.
Yes. The parenchyma is okay. Okay, I will take more proximal. Okay. It's okay. No problem. It's okay. Right. Okay, now everything is okay. Okay. Some blood from the system. It's prophylaxis of any kind of emboli, yeah? But it's also possible emboli. Okay. Now brain is clear. Yes, it's clear. Okay. It's a common carotid injection. Okay. Jay крутитесь. Джей, война держишь. Вперед. 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 There is a clot. It's look like clot. Okay. Let's compare with the beginning. Let's compare. Okay. Okay. This is in MCA. You see? It's in the MCA. Okay. It's quite distal, huh? Yes, it was on this image. It was more selective. It was clear, and then yes, on this image it was clear. You see? Okay. You see, there are two branches going from that point. The both are there, but there is a clot. Maybe we'll go with the small yes, in this upper branch it's a clot, and the small part is going down part, huh? Okay. Ayol, не көрсетесіз catch mini 20 деген бар. Ең астына. Сыртын көрсетші. Catch mini 20 он жеті. Все хорошо. Нені дайындасаш? Эшелон ан жақта бар. Пока дайындап тұр, но ашпай тұрады. Okay, let's wait. Maybe it will resolve. No heparin. Because of the spasm, I think it was formed. Now it started occluding. Okay, started occluding. Echelon men catch me dasher. Okay, let's go. That branch is occluded, huh? Okay. Okay, this is catch mini. Just tromp. Echelon. Okay, we will use the hybrid. Need to see which one is alive. Так, они ждут. 20-ку. Джоки лежит. Так. Okay, stricken. Okay, let's see which one is alive and this is dead. This is dead and this one. This one is also look kaput, huh? It's look like kaput. Космонавт.
Еще немножко поехали.
So which point you are saying?
This branch,
Okay.
you see, it was there. It's coming like this, then it's a bifurcation. Now it's occluded. It's speech cortex,
3.
Broca zone.
M3.
M3, yes.
Ну, вроде нормально крутится.
Yeah, about. Тратор per second. Бурмай тратор. It's so-called distal thrombectomy. Yeah? Good thing. Same topsis. And then we need to navigate to that branch. It's going here. It's echelon 10. We have a catch mini, and catch mini goes through the 17 microcatheter. Torkevink izlesin. Smart mask пересешь. Navigate koyuyorsunuz. Navigate. Stop. Osla. Yes, as usual, clot is going to the easiest branch. Huh? And we have there are two branches. One is going like this, and second is going straight. I think it's second one, yes. Okay, let's see. Yes, it's going like this and then going down. Yeah? Yes. Nice. Yes, it's up to the Sylvian point. That's why we can use the pinching. Eh? Pinching. Okay, let's anopsis. Huh? Let's do this more selective angiography. Yes, it's a branch, and there is a thrombus proximal. Okay. Let's take flushing. Su gelsin. We need to wait for the water. Birisi. Like, just a second, like. Is it water? Stop. Now start. Okay. Так, вперед жүресіңші, тағы да. Ана контраст артта жүру. Керісінше. Жүр. Ана контраст артқа жүрген жүру. Стоп. Назад. Стоп. Ага. Smart mask. Okay. You can take the hub. Yes. Okay. With the catch maxi, catch mini, should be very careful because the visibility is a little bit weak.
I use catch max.
Catch maxi.
Yeah.
Yes. There is a lot of markers, but with the old tube on the machine, it could be quite risky to use catch maxi. Yeah? No heparin. Before we'll take out the clot, no heparin. Okay. Now.
Not opening.
Okay. We are out of the clot. Huh? Let's do angel. And now I will try to pinch it.
Open.
Yes, open, but if we will take it out, it will close again.
Pinch with microcaliper and pull out.
Okay, let's see. Stop, smart mask. Назад. Stop. Okay. I will try to pinch it. It looks like it's pinched. It looks like something's there. Okay, let's see. Okay. We need more. It's a fresh clot, that's why it should come completely. Okay, let's see the territory. Yes, it's cleared. Yeah? Вперед. Maybe distally something, but it will resolve. Yes, at this point. Вперед. Yes, the venous part looks okay. Okay, let's see the catch mini. Yes, Rawan, I think cleared. Yes, it was small clot. Okay. Yeah, it's just a 1 millimeter clot.
Yeah.
Okay. It's for teaching. От ошонай catch mini деген бар, ошонай.
Sir, question?
It's in Kyrgyz language. Ошонай. This. It's a little bit different than Kazakh language, Kyrgyz language. I have more than 15 fellows. They stayed in our department. And from 3 months, from Kyrgyzstan, yes. We trained them. I hope one day they will say yes. This is our sensei. Okay. I will take it back a little bit. And now, oh, it's okay. Now I can sleep in the airplane. Yes? Yes, it looks clear. Huh? Okay. And venous stagnation is no problem. Now we will do CT. Kıtı, Orhan. Kıtı. It's look like. Okay. Let's wait city. Okay, dear colleagues, the city is ready. It's an expert city, and let's check. This part of the brain looks normal. This part also. This is the branches, and this is artifacts. And let's see the coronal view. And on the coronal view, everything is clear. Yes, we can extubate the patient and can give 2000 units of heparin. This looks clear. Yes. Okay. We'll finish this case. Nike, let's go. We'll finish this case. In 20-25 minutes, we will be online again, and I will try to explain about the micro catheters, micro wires, some embolic stuff on the camera online. And Naik from Hyderabad. Say hello to Hyderabad.
Hello to Hyderabad.
Mommy, daddy, papi,
Hello, mommy, hello, papa.
grandma, I'm here in
My family is there.
Almaty. Okay, let's go. Okay. Okay, now we are finishing the case. Thank you. Thank you.